Hello and welcome to another episode of Educational. I'm your host, Roy.
I'm Terry.
So we are the podcast that we're chronicling not only my journey through aging. Of course, Terry is timeless and hasn't aged in many years, but also our parents. You know, our parents are getting to that age where they need more help and guidance in different aspects of life. And I think we've got some hard decisions, that are on our horizon. And so we just felt like, my background has been in aging for the last 20 years, and we just felt like there are a lot of people out there that are, looking for answers. Unfortunately, we usually wait till we're in an emergency or in a crisis to look for those. So hopefully we can give people some things to think about so we can at least be a little more prepared. I mean, you can never be totally prepared for the things that happen, but if we have a little knowledge, it'll go a long way. We also have professionals on from time to time, and today is no different. Terry, I'm going to let you introduce Meera.
Meera Raval Deters is the owner of Super Speech Solutions, a concierge private practice that provides online speech therapy to Texans. She received her master's degree in Speech-Language Pathology from Our Lady of the Lake University in 2006. She has worked in a variety of settings, including hospitals, skilled nursing facilities, inpatient and outpatient rehabilitation clinics, charter schools, and private practices over the past 14 years. Meera, thank you for coming on and being with us today.
Thank you so much for having me. I'm really happy to be here.
Yeah, and I guess that I can speak for myself. I won't speak for Terry, but I don't even know that we know enough to even start with any intelligent questions for you. So we may just have to put a lot of this back on you. Is that, well, first off, kind of tell us how you got here. How did you end up in the speech world?
So my dad is actually a radiologist. He's a doctor by profession. And I actually found out what a speech therapist does because of that. So my dad had been working at Hermann Hospital in Houston. And I think this was right after I finished high school. I had no idea what I wanted to do. Some people know exactly what they want to do when they go to college, but I had no idea. So my dad had the brilliant, of course, now I think it's a brilliant idea, although my dad always has brilliant ideas,
right,
honestly. Right. But he had the brilliant idea for me to come to the hospital with him and observe what 3 different kinds of therapists do. So I observed physical therapy, occupational therapy, and speech therapy. And the second I saw what a speech therapist can do to help adults, in this case, we're in the hospital setting, I was really just taken with being able to help people with communication. And I still remember, to this day, and this was, of course, now more than even 14 years ago, because I hadn't even started college at the time. I actually saw that the speech therapist was helping someone who was in an ICU unit. I think they had suffered wounds of some kind, and they were actually having trouble with their voice. And so she was actually helping them communicate in terms of talking. And I just found it so fascinating. I remember asking questions and just thinking, man, this is what I want to do. I want to help people with this. And even though I observed occupational therapy and physical therapy, I'm just not really, I do work out and stuff, but I don't feel like I really have the physical strength to do those kinds of things. But I do have a lot of respect for people who are in both those professions, because like I said, I don't think I could have done that. Right. So that's pretty much how my journey started and how I decided I wanted to become a speech therapist.
Okay, that's cool. I mean, I think that's awesome to be able to expose you to those. And it's not my parents' fault. I'll give them credit. They've tried. But, I got out of high school, didn't know what I wanted to do, went to college, didn't know, and still there's days I'm not sure what I want to do. So it's still ever evolving.
Your dad was very brilliant in that way. That's awesome.
So tell us, what are some things, and I know it's there's a lot to it, but tell us some of the major things that speech therapy that you do for people, things you can help them with, or things that you do to help them.
Sure. So I think a lot of people, honestly, very commonly, I feel like people come to me and they think I help with public speaking, which is not what I do. That is not what I do at all, actually. So I'm glad you asked that, because I feel like a lot of people who have not really had too much exposure to the field really don't know what a speech therapist can do. So just to clarify, speech-language pathologist and speech therapist actually mean the same thing. So number one, that's just important to know. They mean the exact same thing.
Okay.
But in terms of speech therapy, and I know today we're talking more about adults. I do work with both adults and kids, but for our purposes today, in the adult world, there are a lot of areas that we can help with. Swallowing is one big area that we can help with. So sometimes, unfortunately, you know, when people get older, if they have a brain injury or stroke, or, you know, something happens to their brain, could be dementia, could be, you know, they have a bleed in their brain, lots of different things unfortunately can happen. They may have difficulty with swallowing. So that can look like someone choking. It could look like someone having that really wet, gurgly voice quality where it just sounds like, oh my gosh, that doesn't sound right. Something went down the wrong way. So oftentimes we can be consulted to help with swallowing. Voice is another whole area we can help with. So sometimes what happens, like I said, due to various injuries, someone can actually have trouble with their vocal cords. So it actually means that their vocal cords are not opening and closing as they should. So it can give their voice a very different quality. And a speech therapist can help by prescribing certain vocal cord exercises that can help. And oftentimes they may have to go to an ENT or ear, nose, throat doctor who actually scopes their vocal cords to see if they're opening and closing correctly, because speech therapy actually can't even be cleared for, you know, speech therapists can't be cleared to do therapy until, you know, actually knowing the diagnosis of the problem in that case. Cognition and memory is a whole nother area too. So if someone is having difficulty with short-term memory, you know, whether it's due to Alzheimer's or dementia, or it could be due to a brain injury, that's definitely a big area that we can help with. There can be lots of different things that we can do to help, but I would say mainly a lot of caregiver training, you know, is something that we do in that case. You know, it might be recalling names of medications. It might be, you know, recalling daily activities, might be helping someone come up with a schedule for what they do during the day. So even with cognition or memory, like there are a lot of different things I think that we all take for advantage. Our brain is responsible for so many different functions. It could be related to problem solving. It could be relating to processing, you know, it could be relating to social skills. I mean, it's a whole host of areas that we can help with, even just under the area of cognition or thinking.
Interesting. So now, and I know that you work with children, let's kind of just back out the group that you may help due to trauma. You know, so is this something that as we age, that typically we're going to need to see a speech pathologist, or is it that only certain things like the dementia or other physical ailments will trigger it? And I guess I guess kind of the question is, does it become more common as we age in general?
Well, I think it can, but I think it really depends on the health of the person. So, I mean, generally speaking, you're not going to see a speech therapist unless there's a specific reason, like there's a decline in communication, right? The communication is not happening as much, or memory is not as good as it was before, or swallowing is not as good as it was before, or the way someone's voice sounds. So generally, I would say that we're consulted, especially in the cases of Parkinson's, dementia, Alzheimer's, brain injury, or stroke, really are the most common areas that we're oftentimes consulted upon.
Okay, so there's definitely going to be, I guess there's definitely going to be a trigger mechanism there that sets off the need for you to come in and see people.
Right, exactly. And the other thing I wanted to mention that's also a really interesting area in terms of working with adults. So one area that I specialize in working with adults, now this is not related to injury, but just as an interesting side note to know what speech therapists can do with adults, is something called accent modification. So that's an elective speech therapy service that people will actually seek me out for, to help with improving their speech, improving their pronunciation, to actually help them go higher up in the workplace. So that's a really fascinating whole separate area than what, you know, all the other things we're talking about.
I think Roy enjoys that, because
I was going to say, I probably need to sign up for that one there. I don't know.
No, I like his accent, but you could teach him not to speak. I mean, just to speak like in a I was going to say normal tone, but that's not what I mean. You know, just like middle of the road, Midwestern-ish, no accent.
It's funny. I lived in Massachusetts for a while, and you know, I had somebody be like, "Wow, you don't sound like you're from around here," and I'd be like, "No, I'm from New Jersey," and they're like, "Oh, okay." Really? Do you think I sound like I'm from New Jersey? Yeah, that's been
That's an interesting thing about accents. You know, even wherever you go in the US, people can sound different, let alone all other countries in
Yeah.
the world. And like I said, you know, that's a specific service that people will come to me for because they feel like they're not being very well understood
Yeah.
at work. So for purposes of, you know, that, they feel
Yeah.
like it's actually hindering their progress, how far they can go up in the workplace.
Yeah, and it's unfortunate because I've made peace with this at my age by now. But people think that you're from the South and you sound that way, that you're probably not too intelligent or you're just
You're
kind of
slow.
slow on the
Yeah.
uptake. So, but is this learn to just learn to deal
Go
with that.
with
So,
it
yeah.
and use it to your advantage.
But it's a thing actually. I mean, and
Right.
I see where that could be very beneficial, especially if you're younger and want to try to move up in a company. Very interesting. Another thing, I don't want to dwell on that too long, but it's just funny you brought that up because the other thing was that as I stayed there longer, I think my accent kind of started going away. But they said that whenever I would pick up the phone and talk to somebody in Texas, they said that my accent would immediately go back to, the deeper Southern accent that I used to have. So anyway.
Yeah, we used to do that with my cousins in West Texas. Man, we used to make fun of them because you couldn't understand a word that they said, and there
Oh,
were
really?
about 5 or 6 words that were strung together to make one. We were just like, what? What are you talking about?
So anyway, let's get back to the.
But I
to,
agree with
oh,
Roy,
no.
what you were saying about the stereotypes are unfortunate.
Yeah.
I mean,
Yeah.
that to me is a really negative piece of it. I mean, I feel like everybody just needs to respect that, people of all different ethnicities, races, and from all different areas geographically are going to speak different. And sometimes I feel like that's not something that happens, unfortunately.
It doesn't.
Yeah, no, it doesn't. Well, let's go back to the aging, and so the swallowing is an interesting piece that I don't think a lot of people would know that you actually deal with that, but it just I guess for a lot of different reasons it can be hard to just swallow our own saliva, but then also if we have food or drink that people get where they just can't swallow like normal, or they start aspirating, I guess, of some kind.
Right, exactly what you're saying. So what happens is there can be weakness of the muscles involved for swallowing, like I said, due to different incidents that could happen or injuries as such. But yes, oftentimes there can be a risk for aspiration. So aspiration being that things could potentially have the possibility of dumping into your lungs, which of course we want to completely avoid because aspiration pneumonia is a serious thing. We don't want that to happen to anyone. And so oftentimes when a speech therapist is consulted, like I was mentioning before, if there's signs of, choking, certainly, and if they're drinking water or they're coughing quite a bit, like not someone who has a chronic cough outside of, eating or swallowing, but let's say suddenly someone starts choking, they start coughing, or they just have that really wet, gurgly vocal quality.
Yeah.
Those are really the biggest signs that we see. Or if they have like a spike in their temperature after eating or drinking, that can oftentimes indicate that there's a potential possibility of aspiration pneumonia. Now, if we suspect that there's a possibility of aspiration, then we'd actually do a diagnostic test. The radiologist is actually called a modified barium swallow study. So that's actually an X-ray study that's done. Like, you do have to do it in consultation with a physician or an MD of some kind. And then you're actually looking, or client, you're having them drink, water, and you're actually looking at the X-ray as it's happening. So you're looking on the screen to see, hey, where is that water going?
Oh, interesting.
And then you do that with different consistencies. You might do that with like something that's harder to chew, like a cracker, versus something that's puree, like applesauce. So basically, all that to say, if you look at an instrumental evaluation like that, you can actually make a very specific, safe diagnosis and recommendation in terms of what that person is safe to be eating and drinking.
Okay. So let's kind of staying on that path for a minute. So do you go in and let's just say, somebody has had a marked marked change that they used to could eat and drink no problem. Now they're kind of coughing, hacking, choking a little bit more. So we call you in. I guess you go to the ear, nose, and throat doctor first. You get a diagnosis, and then you come in and work with them. So are there?
Right. So the order would come from some kind of physician. I'm sorry. Before
Okay.
I was just saying ear, nose, and throat. That was specifically for vocal cords.
Okay. Oh, okay.
But
okay.
a doctor, their MD has to write the order for speech therapy. Correct?
Okay. So then, are there exercises or things that you can do to help make it better, or do you have to think about adjusting the diet to where they're at, or some combination of both of those?
Yeah, that's a great question. So it actually depends on the individual. Sometimes there are strategies that they can use that may help them with swallowing. So sometimes we might recommend something like a chin tuck, which is like I did right now, which is actually where you're bringing your chin all the way down before you swallow. But typically, if we're recommending a strategy, we'll actually try that during the instrumental evaluation, the modified barium swallow study, to make sure that that actually helps. And, sometimes we might recommend using a straw is okay, or it's not. And like I said, all of the recommendations we're making are based exactly on what we're seeing. So it's all, based off of the information that we're getting from the diagnostic imaging.
Yeah, that's awesome. It's not really just guesswork like, well, I've seen this before, maybe we'll try this. It sounds like that
Right,
there's
exactly.
there's kind of like real-time information to say this is what's happening, but then also to say this is what we've tried, it's helped or not helped.
And one of the biggest things we do is, again, staff training comes in, caregiver training. A lot of times we'll post swallowing precautions, in a hospital room, or if we're in a skilled nursing facility, we'll post them bedside, and we'll talk to the nursing staff, the nursing aides, and we'll train everyone on the swallowing precautions. For example, the person needs to be sitting upright at 90 degrees every time they're eating and drinking. That's even if they're on a feeding tube, et cetera, that's still the case.
Oh, okay.
So there's some general precautions like that. You want to make sure the person is alert while they're eating and drinking. Again, that's another general precaution. And then, the specific diet recommendations and strategies, after that, they're then tailored to the individual.
Yeah.
I'm going to sort of digress a little bit, but do you know anything about Schottky's rings? It's like
no,
my mom has what's called Schottky's rings, and they're just rings that enclose upon her swallow. I mean, it has something to do with her swallowing mechanism, and it's not working properly at the same time to where, she gets things down in the same, the way that she swallows it. And so I just was wondering if she's had it for like 20 years, and she has to go in and get scoped, and they have to expand her throat, So I was wondering, well, he's never.
No, that's okay. No problem. No, I haven't heard about it.
Okay.
So.
Okay. So what kind of caregiver, what kind of caregiver strategies do you talk about or suggest? What can caregivers do to look to see if they may or may not need a speech therapist?
Yeah, I think that's important to know. So I think if you see that someone's not communicating as well as they were before, that's definitely a time that we would want to be consulted. And the caregiver, I want to reassure anyone who's listening, especially the caregiver, knows a lot of what's going on. It's definitely good for them to go directly to the MD or to the doctor and say, hey, something's not right here. Like, what can we do? Because the doctor is the one you want to keep really good in touch with, because like I said, they write all the orders. They write orders for, occupational and physical therapy as well as speech therapy. So, like I said, we can't do anything unless we have the order, just to emphasize that. But beyond that, I would say if you notice that they're having more trouble with their memory, maybe they're not able to remember daily life activities, or, their communication sounds different. Like sometimes, your voice can sound slurred, right? So that can happen as a result of, potential mini stroke, or, ischemic stroke, or, a full on stroke. So if you notice anything that's different with swallowing or with communication or with memory, I would say those are the biggest ones, to look at consulting a speech therapist, as well as If there's a progressive, disorder or disease that we're talking about. So oftentimes, we do work with people who have Parkinson's and dementia. And, there are, of course, different phases to those specific diagnoses that I'm talking about. But oftentimes those are things we can help with. And I know with Parkinson's, a lot of people will think, oh, well, physical therapist is involved. Well, sure, certainly they are, because a lot of times they will need help with walking. But more of the speech therapy side would be helping with the voice, and a lot of times talking at like the volume that you and I would be talking about is a challenge. So there are some exercises that a speech therapist, can actually show, the individual patient or client. And that's also where caregiver training would come in. If there are exercises that we're recommending, as a home exercise program, then that is a person who could help, their loved one complete them on a daily basis, if that's what we're recommending.
So what about getting you involved sooner rather than later? And I realize we need to be cognitive of what's going on so we can go to the doctor to keep them involved. But what's the benefit of recognizing these signs earlier, sooner rather than later, getting to the doctor where you can get involved before, is there a point that there's just no return, or it just takes you longer to get them back to a better place?
Well, I think that's important information. I think it kind of depends on the setting a little bit.
Okay.
Because what happens is, if I'm a speech therapist working in acute care in a hospital, I'm going to see that patient sooner than if I'm working in a rehab center.
Right.
Or if I'm working in a skilled nursing facility or a nursing home. So I would say, me personally, having worked in different settings, in the hospital, if someone's in acute care, you're going to be, as speech therapist, you're going to be seeing them sooner, just because, the nature of, like, for example, working in a stroke unit, you're going to be consulted a lot sooner, because there's a lot more medical involvement at a hospital.
Right.
But if I'm a speech therapist at a rehab center, like when I worked at one in Houston a while back, I did work with people, but it was after they had been through the hospital and they came to us and they were an inpatient or outpatient, but they were fairly medically stable at that point. So I think that really depends more on the setting. And also, similar to a hospital, if I'm a speech therapist working in a skilled nursing facility or nursing home, I'm going to be, again, consulted more. I'm going to be consulted sooner because they do have doctors that are making rounds on a regular basis. So I probably am seeing someone who's going to have more medical involvement. They may not be as stable, but really then it depends, because there was a skilled nursing facility I worked in that one side actually was a nursing home. The other side was a skilled nursing facility. And I saw people who were on both ends. Okay. So in the skilled nursing facility, I actually saw a lady, for example, who was living by herself. And she was fairly high functioning, but then I also saw someone on the other side who had really serious Alzheimer's and, had a lot of trouble with swallowing.
Yeah.
So I think even within each setting, there can be variation. It just a little bit depends on where you are.
Okay. Yeah, and that's something, just talking about the eating, because I will say I am a fast eater, and, the bigger the bite, the better, just to move it. So I think once we get to a certain age, and then as a caregiver, we're in a hurry to we got to get this done so we can move on. But I think maybe just taking that time to slow down, smaller bites, give them time to really process it if they're having some troubles anyway. I'm sure it takes longer to chew, and just patience, I guess, is what I'm trying to say.
Patience is a virtue. I absolutely agree. But you did bring up an important point to really take time with eating, and swallowing is really important, and take really small bites. If you try to cram your mouth and you're already having trouble with swallowing, it unfortunately won't do anything good. So that's another general swallowing precaution we do recommend. Like I said, having the person sit upright, making sure they're alert, and making sure they're just eating really small pieces of food. Yeah. And then a lot of times we may also recommend, that they're alternating the liquid with the solid, meaning every time they're eating a bite of food, they're, drinking water or coffee or tea or whatever it is after, to kind of wash it down.
Yeah, what are What are some success stories that you've seen? What's the, kind of one of your favorite episodes that you can remember where you feel like that you've just brought somebody back from a bad place to, a better place for them and their families?
Well, there's one individual that I've been working with, and he suffered from a more minor brain injury. And unfortunately, because I left that position and, after a while working with him, I didn't get to completely see, what he was doing after.
Yeah.
But all that to say, it was pretty great to actually have him work on math. And we did get to go out in the community. He and I would go out on one-to-one outings. So when I worked at a place called Mentis in Houston, we were responsible for community reintegration, meaning we actually took our clients out who had a brain injury or stroke out into the community. So we would go shopping at the mall. We would go to Target. And so he and I was great because he and I would go on individual outings. We had this 16 passenger van. My God, it was so hard to drive.
Huge.
That's a whole nother story, let me tell you. But it was really fun because he and I would go on outings. And I remember one time I took him to a popular area in Houston. And I literally told him, I need you to do the following 10 things and meet me back at, 2:30. And so I gave him a certain amount of time. Well, he was actually, really good at all the stuff I gave him. And the thing I really enjoyed about working with this particular individual is very highly motivated.
Yeah.
He would come to me, even if I just had my door open and I was working on other stuff, he would come to me with homework I'd given him earlier in the week and say, hey, Miss Meera, I'm done with this. Can you check with this? I'm ready for more. And we were actually training him to go back to work. I don't remember where he worked, but we did have a vocational rehab therapist at Mentis as well. And so she was also, of course, helping with that. But it was cool because, he and I were actually working on a PowerPoint and he actually presented it to all of the staff. And I mean, he was doing pretty well, even when I left. And like I said, unfortunately, I wasn't able to keep in touch to find out what he was doing, but I was pretty impressed with where he was at. And to give you an idea, when he first started, I remember he wasn't even completely oriented. He couldn't even tell me. I mean, I think he knew his name, but he wasn't completely sure about the place and the time. And so, I mean, the brain really has a remarkable ability to recover.
Yeah.
How long of a period did that take? That you were working?
Couple of
with
months.
Okay.
Couple of months.
Yeah, and that was the next thing I was going to ask too, is about typically, once you start seeing, and I know it's based on their severity, but, what's the average interaction that you have with your clients?
I would say, for brain injuries, what I know from research and what I've heard and working with my coworkers from before is that most of the progress you see is within the first year and sometimes up to the first 2 years.
Oh, wow.
But oftentimes, the individuals that I'm talking about, I worked with on a daily basis.
Oh, okay.
And the interesting thing about, like I was saying, the job I was at before is all of us did group sessions and individual sessions. So we're talking a couple of hours a day of intensive therapy. I mean, it's no joke. I mean,
wow.
You're signing up for intensive, like I said, for purposes of what I'm talking about, the rehab program that I was in, you're signing up for quite a few hours of therapy. So these are people who could, I wouldn't say they could tolerate 100%, but they would get to the point where they could, basically. That makes sense.
Yeah, that's a lot. It's a lot more intensive.
Some heavy duty work.
Yeah, the intensity and then the length of time is
be
much, much more than what I expected. Interesting. Yeah, and it's got, let's talk about the...
But, if someone's...
No, you're fine. Go ahead.
Oh, I was just going to say, if someone's at a hospital, still as a speech therapist, you're seeing them on a daily basis.
Yeah.
I would say at a hospital, though, the therapy is not going to be as intense, obviously. But typically still, there's occupational therapy, speech therapy, as well as physical therapy. Yeah. But you're not probably going to be doing as much therapy. Still, therapy is there.
Yeah.
But the intensity level, of course, can only be higher once you're out of the hospital because you're more medically stable.
Right. So let's talk about the psychological aspects of this for just a moment, because I can only imagine as, the person that you're helping not being able to communicate or not being able to eat very much, I guess, makes you feel kind of defeated and, are we ever going to get through this? And I'm sure there's, some desperation and direness with the, the actual client, but then also, with the caregivers and families surrounding them, with them being uncommunicative or hard to communicate or having these troubles, I imagine that it can be kind of tense, or and maybe that's not the best word, but maybe I'll let you explain. Yeah, frustrating for sure.
Well, I think it can be a large mix of emotions, especially depending on where the caregiver is in their journey.
Yeah.
And I think it's a very, very difficult process. There is, I would say, some grieving involved, in the sense that even though that person is still physically alive, unfortunately, after something happens to your brain, you're not exactly the same person. So, a lot of times I would hear stories from, husbands or wives where they would tell me, oh, they used to function at this level. They used to be in this high level job, and things are just really different. I mean, I can't imagine. That is, I think empathy goes a long way, and really just understanding that, these are people who are used to their loved one functioning very differently. They're here because they have a problem, and they're relying on you for help and support, and they want to know how they can help. But there are going to be days where they're frustrated. They want to hit their head against a wall. It's something they have to deal with day in, day out. It's not something that, there's not really an easy fix. I mean, time heals all, right? So it takes a lot of time, takes a lot of patience. And I think that's important to remember. I think it's really important to realize where they're at, and not to take things personally. I think can be hard, because I think that's something all of us want to do. But I think sometimes, the caregiver may lash out, but it's because they're frustrated, and because they're going to do that with everyone. They have not singled you out individually. It's not you. It's the experience of what they're going through that they're frustrated with.
Yeah, and for caregivers, I mean, how anybody who's in a caregiving situation, it's so hard not to do whatever task is at hand, let alone let somebody. I mean, that's what your whole business is based on, helping people, but you have to know how much to help them, how much is too much, because they need to do it themselves, right?
Exactly. So I think one of the challenges is that you want the person to become more independent, and so you don't want the caregiver to be doing everything for them. So there is a fine line, and let's be honest, sometimes there can be friction and frustration, but there's also the positive side of that, where the relationship evolves over time and people understand each other better, and people understand that, hey, even though I want to do everything for my loved one, I'm not going to help them by doing that. I need to actually do less for them so that they feel better, they become more independent, and they feel more confident.
Yeah, and there's a lot of that masking that goes on, I guess, with couples, because just like us, I mean, I may at times be incommunicable, but Terry knows my thoughts and can finish it or go do something for me. So while I understand that dynamic, I think as loved ones, caregivers, whatever, I think we have to kind of realize the longer we put this off, either the less chance they have of getting some back to normalcy, or the longer road that we're going to put them on to do that, which was kind of leading into my next question about, so on average, how far can you bring people back usually? I mean, is it like you get them pretty much back to normal with their speech and swallowing, or is it just usually some improvement from where they were? What does the end product usually look like?
I think it depends on the nature of their injury. So definitely for someone who has a more severe brain injury, it's hard to predict how much they're going to recover. Like I said, the first year is really crucial, up to the first 2 years. But I would say, generally speaking, their prognosis may not be as good, just because there is a much larger injury or bleed in their brain. So I think those conversations can be difficult, because you're looking at someone who ends up going home, where home has to be much more structured. For example, they need to have a schedule of what they're doing every day, like they did with us in rehab. Versus someone who might be ready to go back to work, like the individual I was talking about before. He was getting there. I mean, he was probably pretty close. Like, he may have gone back to work, in a modified position, probably not exactly what he was doing before. But, I think it just depends on, I think it depends on a lot of things. I think it depends on where the bleed is in your brain and the nature of how severe the bleed is. I think it also depends on unfortunately, some of the things we're looking at are progressive, like Parkinson's and dementia. And so unfortunately, we know that those things change over time.
Yeah.
And there is some deterioration that happens with that, which again is really difficult to process because you're used to seeing someone one way, and then, over time things get worse. So I think it just depends on the individual.
Okay. Yeah, and it's always good to, manage expectations. Sometimes as loved ones, we're always hopeful
Sure.
that things will be back to normal, but sometimes they won't. And so we have to, it's good to understand that we
Accept
there's
the
just
new
so much-
norm.
Yeah, yeah. All right.
Right.
Well,
Those are the really, really difficult conversations to
Right.
have, though. Those
Yeah.
are the hard
Oh,
ones.
for sure.
yeah.
You had some advice about iPad apps, maybe that might be helpful.
Oh, yes. I'm glad you reminded me about that. So I have a few actually that would be helpful. So one thing I wanted to mention that we haven't really talked about is something called aphasia. So aphasia is a loss of language when you have a brain injury or stroke. And the reason I mentioned that is because that's oftentimes when you have difficulty with communication.
Okay.
And that can look different. It can be the person can sound really fluent, but they're not making sense. Or it could be that, they're using limited words. I mean, there are a lot of different types. So basically, I would say overall, the person has difficulty using a complete sentence. They might speak in phrases. They might not be able to use words at all. They might not be gesturing. So one thing before we get to the iPad apps, I want to mention that's important for someone like that is having a communication board. So there are actually some really great ones you can get online. You can kind of even make one your own, but essentially the purpose of a communication board is having that person point to, things that are really important. Like they can point to yes or no, or they can point to how old they are. They can point for their basic wants and needs. So typically I would say in acute care in a hospital, that's something a speech therapist will bring on day one if someone has had if someone's having that kind of trouble with their communication. So that's a really important one, because what happens is, since communication is so vital, people are relying on, even the person who is in the hospital to be able to communicate. But if they're not able to, it's really frustrating for that person and for the whole family and the caregiver. So that's just a really good thing in general to keep in mind. And like I said, there are a lot you can get online, or a speech therapist can bring you one. But really, it can also be just, having pictures of family members available close to the bedside, and just having the person be able to point, or, having the names written out. So basically you have a lot of visual aids in front of you that can be helpful. So you're not relying on the person being able to use their words. You're relying more on, I would say, nonverbal communication in that case.
Now, is that typically brought typically brought on by some kind of a traumatic brain injury or stroke as well, or is there other things that cause the aphasia?
Yes.
Yes. Okay.
You're right, correct.
Yeah, okay.
So what happens is, if the side of your brain, the left side of your brain is responsible for language. So any injury to that side of the brain typically will involve loss of language or loss of communication that we're talking about in this case.
Okay.
But one of the good series of apps for aphasia or loss of language is Tactus, Tactus. They have a whole host of apps that are really awesome. There's a series that I've actually used before, but it can help with lots of different things. Naming pictures. One of the things I like about it is that it can be really interactive. And so if a patient or client is using it, it can give you the first letter, for example, of the word. And so it'll give you like hints for you to come up with what the actual word of the picture is, or the name of the picture.
Okay, cool.
And then there are higher level ones where you're working on reading comprehension and stuff like that. But there are also two other good apps that I wanted to mention as well. So Grocery IQ is a really good one. Honestly, whether someone has had a brain injury or stroke, if I was personally still going into a grocery store, which I'm not because I don't miss doing it because of COVID, this one is a really helpful way to keep track of a grocery list. And you can even personalize it to the store that you go to and the coupons and everything. It's actually really cool. I would totally use it if I was still going to the grocery store.
Okay.
All right.
So that one's really handy. And then there's also one called DoseCast, which helps with keeping track of medications, which I know can be important, especially when people are on multiple medications, because I know they have to be taken at different times. They look the purpose for each one is different. They might look different. Being able to keep track of that. And I would say definitely that's also an area that we can help with in terms of speech therapy. So oftentimes if someone is at the level where they can cognitively, like from a brain standpoint, work on learning their medications, we have actually worked in conjunction with nursing staff and gone through all the different medications and written out a list. Okay, you're on this medication for blood pressure. You're on this one for, whatever it is. Yeah. And then actually taken pictures of the medications and written down the dose and everything, so that you can help, that person be more responsible and know what they're getting. So I remember we would actually have some people trained to the point where nursing staff would show up and that person would like open their checklist and say, okay, so I'm getting such and such right now, right? Like it was actually really cool.
Yeah. And
really
what was that called again? A dose pest?
DOSECAST, DOSECAST.
Okay.
Mm-hmm. That brings up a good point too. We always talk about, having these conversations before this traumatic event, if possible, is that, it's, sometimes you can find the medications laying around, but, there are times when you can't. And this is why it's good to talk to loved ones, especially to get those lists of what are you taking, what's it for, when are you taking it, was the doctor that prescribed it, so because let's just say in the event of I'm out of medicine, I threw the bottle away, I'm waiting on something, and something bad happens, and then nobody knows that I was really taking that medicine. So anyway, I just feel like we can never have that conversation soon enough, get it documented, can save us all and save you and your loved one a lot of heartache as well.
Absolutely. And I think using a pill box also is helpful too.
Yeah.
Yes.
Like the daily ones where you're actually opening it. So you can open it later and see, oh yeah, I already took that. So I'm good.
Yeah.
Oh yeah.
Yeah, we have to do that even just for our
just
vitamins and supplements, just because it's so much easier. Because I'll take them in the morning, and then about mid-morning, I'm like, ugh, did I even take that yet or not? So yeah.
Right. So it's like a visual reminder, right? It's helpful for anyone, really. If you're on, taking medications, you can look and see, hey, I took it or I didn't. Okay.
Yeah. And when I don't take it first thing, then Terry sets it out on the countertop where I have to trip over it next time I go get some water or something.
Yeah.
So.
Did you take it? Did you take it?
I'm sorry, I didn't mean to interrupt you. Do you have any more apps, or is those it?
No, I think those are the main ones I was thinking of. Yeah, those are all the really good ones.
Okay.
Yeah.
Well, thanks so much for taking time out of your day. A couple questions before we go. What is an app or a habit? What is something that you use every day in your personal or professional life that you feel adds a lot of value?
Oh, I like that question. So I actually meditate every morning. That just helps me stay focused and stay grounded. And I've been doing it for a while. And now for some reason, I don't do it in the morning. It really throws me off.
Okay.
And I really don't like it. So I definitely try to do that. That just helps me. It just helps me focus, really.
Yeah. Okay, great. Yeah, and that's a good, we hear that more and more about, about this. And I've tried it. I just need to get in the habit of making myself do it, because I know, like yesterday we were talking, I was a little scattered, and I told Terry, I'm like, I just need to maybe meditate for like 5 minutes to kind of, recenter and get my mind from being so scattered. So, yeah, thanks for that.
They have a lot of apps. I don't actually use one myself. Well, I do use some inconsistently. But in general, if you search apps, there are a lot of cool ones that will, run you through a guided meditation. So one thing I want to say about meditation is that I think a lot of people think you have to sit there in silence. And I have a series of what I go through in my own head. But guided meditation is still meditating. I think meditation, people just think, you're sitting there like this.
Exactly.
But it doesn't have to be that.
Right.
No, that's not whatever your catchphrase is or your little home.
Yeah.
So it can look all kinds of different ways. And for some people, honestly, their meditation is walking outdoors. So, I mean, I think you just kind of have to know what works for you. That's something I enjoy, just going for walks in nature.
Yeah.
So
that's kind of mine, is going for.
I don't do that every day, but that's something I try to do at least once a week.
That is such a good mechanism to clear my head. I think that's more of my meditation, is just having that quiet time, walking through the nature. Anyway, it's good to clear our head. We need that for our creative energies, and also, for me, problem solving. If I'm bumping up against something I'm having a little trouble solving, sometimes getting away from it, clearing my head, I come back with a, whole different perspective on that as well. So that's good advice.
Yeah.
So tell everybody, so who can you help? And I realize that we have to have doctor's orders, but basically, who is your clientele? How can you help them? And then how could they reach out and get a hold of you?
Sure. So the name of my company is Super Speech Solutions LLC. That's actually the name of my Facebook business page. It's also the name of my LinkedIn page. And then my Instagram handle is also Super Speech Solutions. So I tried to keep everything easy. My website also is the same. It's superspeechsolutions.com. And then my email is Meera, Meera, at superspeechsolutions.com. And in terms of helping people, there are actually a whole host of people I can help. Like I mentioned, I do work with children. I can help children, especially I specialize in helping children build their language skills. I specifically specialize in working with children who are autistic. In terms of adults, more of the piece I can do with adults is caregiver training, because right now I'm not accepting insurance. And because of that, I can only see people who are 65 and under. But if someone wants to do caregiver training, it doesn't matter what age they are. And I can help in that area. Like like we mentioned before, if there are challenges with swallowing or challenges with memory, and things of that nature, definitely I can help with that. I just can't do the individual one-on-one therapy, like I said, because I'm not an insurance provider. People over a certain age, then I can definitely refer them out in that case.
Yeah.
But if someone has had a brain injury or stroke, as long as they're able to pay out of pocket, I would still be able to help them for one-on-one therapy.
Okay.
Like I said, if they're just under.
Yeah, and it's important,
65 age range.
I can talk to the child perspective for just a minute, because our son had one of his adenoids grew. I don't know if it grew or swole, but somehow it became very enlarged and blocked the drainage tube of his ear. And this went on for some period of time, and we finally found out that he had lost some hearing temporarily. Once it got cleaned out, it came back, but what it didn't really affect his he's still able to verbalize, but he was like in first or second grade. He was very young, and so it kind of put him a little behind. So we sought out speech therapy, in order to get him caught back up on that learning scale. So definitely, all kinds of things can lead to, things that you wouldn't even think about can lead you down that path in a hurry.
Yeah, and actually commonly children who have trouble with hearing have trouble with pronouncing their sounds because they're not able to hear everything clearly. So that's actually a really common reason that people would come see a speech therapist as a child.
Yeah. All right. Well, thanks again for taking time out of your day. We certainly do appreciate it. And that's going to do it for another episode of Educational. Of course, I'm Roy.
I'm Terry.
And
Thank you, Meera.
You can find us at www.educational.com. We're also on all the major social media platforms as well as all the major podcast platforms. A video of this interview will go up on YouTube when the episode does go live. So until next time, take care of yourself and take care of your family.